So the next, yeah.
Do you use your
First is right for techniques one. Okay, hands.
Okay.
do you use intraoppository microscopes for your posterior polars?
Yes, yes. We use it for posterior. Sometimes I use it even during cataract surgery.
Okay.
Okay. So this is a patient with a denser cataract. Yeah. So I'll be demonstrating the MyLoop. You can see that it's a denser cataract. It's like a grade 4 cataract, and the MyLoop is a great device to reduce phaco energy and light kansatama, light and orthari. So we are going to use a 22.5 diopter eye-hands lens. In this patient, I'm using the same parameters as last time on the Signature Pro. That's the temporal clear corneal incision 2.8. ಕಣ್ಣು ಅಲ್ಲಾಡಿಸ್ಬಾರ್ದಮ್ಮ, ಲೈಟೇ ನೋಡ್ತಾ ಇರಿ. 3 ಲೈಟ್ ಇದೆಯಲ್ಲ ಅಲ್ಲೇ ನೋಡಿ. So the cystotome maker. So you can see the cystotome is pretty standardized, and this is the cystotome maker, which is the instrument to make the cystotome. This is available from Epsilon. So you just put in the needle and you crimp it and you get a perfect angulation. Light nodima.
Tune complete. Phaco, chop, vacuum, 600.
So there is a question that can synergy lens be used by the drivers and by the IT people? What would you say?
Yeah, you can use it. IT people, computer, there is no problem. Intermediate is excellent. Drivers, those are doing highway driving, yes, they will have halos. Quality of the contrast drops when compared to a monofocal, but it has a relatively good contrast because of the aspheric design and the Abbe number, higher Abbe number, which, okay, that's the hydro. It's very important to do the hydro before using the MyLoop. You can see that the cataract is grade 4. So see that the cataract is free. And after that, put in viscoelastic. Viscoelastic is to be used as HPMC for the MyLoop. Don't use viscoat, because, so this is the MyLoop. It is made of nitinol with an accentuator. So you can retract it first, put it in, and then you put it under the anterior capsule. Okay, open it slowly. Once it is completely open, then you will have to rotate your wrist so you can see the wire going posteriorly. Once it goes posteriorly in the center, reach the center slightly beyond, then again close the loop.
Center it towards you.
Yeah, I'll just center it.
Otherwise, we saw it very beautifully going at the back because of the
Yeah. So now you have to use a second instrument to support the nucleus as you cut it. So I have cut the nucleus now. So once you cut it, you can either cut it into 2 pieces or 4 pieces. Then you can remove the MyLoop, and I will demonstrate that it is cut into 2 now, 2 halves. Then you can rotate it through 45 degrees. Again, don't rotate it by 90 degrees, but because when you put the MyLoop, it's going to rotate a little. So you just, MyLoop is a disposable device. You can use it only for one patient. Again, see, you can see that it has come to 90 degrees now. Again, you can see the wire going posteriorly, and then you cut it. Okay. So for very dense cataracts, this is a very useful device because it reduces the phaco energy almost by about 50%. So now you have 4 pieces, and I'm putting viscoat. Now you can see the density of the cataract when, because with the RTO you can't actually
Yeah,
make
because
out because the glow is so good.
flow will always be very good with the RTV. That is a
Now it's
Continuous irrigation
the
on.
difficult part in the very dense leathery cataracts is the posterior fibers. They are very leathery and the femto does not cut the posterior fibers. So you can see I'm going to remove, so you can see it's completely separated.
yes.
So you just bring it into the antechamber. You can see the brownish color now. So
Yeah.
this is a
It's a
grade 4 cataract. You can see that the followability is quite good with the Venturi. Okay, so in a dense cataract, it's very important that you stop and then put viscoat into the
Continuous irrigation off.
antechamber because you want to protect the endothelium. And when you use viscoat, I always like to put a little HPMC at the wound because the viscoat does not allow for dispersion of the heat. So you can get a wound burn if you overfill with viscoat. So that's a very important
Continuous irrigation
thing that many people don't realize. So never overfill and always put some HPMC at the wound. So it's a very large nucleus. You can see that. Okay, I'm going to chop it again.
It's a very hard cataract. I think
Yeah,
given
it's a grade 4 cataract.
hardly any cortex and
Yeah, there's hardly any cortex.
so it makes sense to use a loop and decrease
Yes, yes.
amount of energy.
Definitely, if you are a cornea surgeon, you will
Yeah.
you will really appreciate it because it really helps save the endothelium. And I always keep my chopper on top, if you have noticed. That is
Yes.
to prevent the fragments from flying and hitting the endothelium. So using viscoat, keeping your chopper on top of the fragment and feeding it in kind
Yeah.
of helps. So that's the last piece, and you can see that viscoat is still there.
Spot is like another nucleus which is sitting inside again aspirated or
continuous irrigation on.
also I think in this case you made a slightly larger rexus than you would.
Yes, slightly larger rexis, 5.5, but we'll still get a good overlap.
Irrigation off.
You can see the bag is quite clean, so I don't have to do any hydro polish.
Which lens is this? Doesn't look
This
like.
is the IHANS.
Okay.
Again, the IHANS is a modified monofocal. So this basically gives some amount of add compared to the regular monofocals because of the aspheric optic. So it is flatter in the periphery and slightly steeper in the center, and So it gives some amount of intermediate vision. And this helps for day-to-day activities like looking at the mobile phone or computer. And if you do a micro monovision, then you can have a reduced dependence on glasses, and reading also would be good. So with the eye hands, I usually aim for emmetropia in the first eye, preferably the dominant eye if you can identify the dominance. And you aim for about 1 diopter in the 0.75 to 1 diopter in the non-dominant eye, and that gives a good mini monovision and independence of glasses without causing any night vision disturbances. So people who are driving on highways, those who want reduced dependence on glasses, then you can use the eye hands, or you can even use it regularly instead of a monofocal, because it gives a increased depth of field because of its unique optics, about 0.75 to 1 diopter depth of field, which helps. So you can see that the cornea is very clear, there's no wound burn even in this very dense cataract.
Yes.
And day one we see crystal clear corneas. When you use Viscoat and the Myloop, it's a great combination. And of course the white star is cold phaco, and you can choose your on time and off time. So if you have a larger off time, then you have lesser phaco energy and lesser risk of wound burns. So we have one more case. So we can just discuss while we prepare the
Yeah.
next case.
I think again very nicely. I just wanted to know